and welcome student nurses to our seminar today. Thank you for having us back here at Notre Dame. Today we're going to talk about strokes, or the medical term cerebrovascular attack. My name is Elizabeth and I'll be talking to you today about signs and symptoms. Next will be Ebony and the risk factors and statistics, Amy about Australian government strategies and the policies in managing the condition, and finally Angela and Courtney, who will discuss the multidisciplinary team and their involvement in management and recovery. As seen on the presentation, this is an amazing quote that explains strokes well. Strokes are a brain attack which occur when blood supply is limited or blocked. This deprives the brain of oxygen, nutrients, and adequate blood flow that it needs to function. This is a medical emergency and needs attention straight away. As you can see on the next slide, these are the two major strokes, but there are three. First, ischemic stroke, which means an obstruction has blocked a blood vessel. This could be from a clot or a clot being lodged in a fatty deposit buildup, also known as atherosclerosis. Next, hemorrhagic strokes, which are weakened blood vessels which rupture, or a brain aneurysm where blood spills into and around the brain tissue. This can create swelling and pressure in the cranial cavity. These are also rarer than ischemic strokes. Next and lastly is the transient ischemic attacks, also known as mini strokes, where a temporary clot is lodged in a blood vessel but doesn't remain stuck. A section of the brain experiences temporary lack of blood flow, which causes stroke-like symptoms but resolves within 24 hours. Unfortunately though, this is a warning sign of an impending future stroke. Next are the major signs and symptoms that most people notice. Other people will remember the FAST symptoms to recognise a stroke. F for face, sudden drooling and uneven face. A for arms, unable to lift their arms up. S for speech, slurred speech or trouble speaking. And T for time, time to call 000. A stroke doesn't just affect these things, it can also affect the whole body in different ways and different strengths. Here's some other signs and symptoms that affect the whole body. Other common signs and symptoms though are difficulty swallowing, dysphagia, headaches, inability to understand simple commands, and involuntary eye movement. You might want to know though that some other medical diagnoses can mimic strokes, so please be aware. Strokes need to be diagnosed and treated as quickly as possible to minimise brain damage and the amount of impairments and disabilities they may cause. Now to Ebony.
The prevalence of stroke varies for each individual. This can depend on each individual's risk factors, which are classed as non-modifiable, so genetic, gender or ethnicity, or modifiable, smoking, alcohol consumption, health literacy and inactivity. You can decrease your prevalence by changing your behaviour and improving your health literacy to enable a greater understanding about strokes and other diseases that are preventable. Strokes was the leading cause of death in Australia in 2016. There were over 158,000 deaths caused by stroke, and more than 55% of stroke sufferers were male. Out of these strokes, 80% of these were preventable by diet and exercise. Someone will die every 9 minutes. That means by the time we finish this presentation, one person in Australia has died from a disease that is preventable by a few simple lifestyle adjustments. As shown by the graph, the age standardised death rate from strokes has been decreasing over the last 10 years, from 51 deaths per 100,000 in 2006 and then 35.7 in 2016. Regional Australians are 19% more likely to suffer stroke than in the metropolitan area. This can be due to the access to healthcare and the lack of health literacy. Remote and very remote areas have stroke hospitalisations of death rates that are 30% higher than in the major cities. Indigenous Australians have stroke hospitalisations and death rates that are twice as high as in non-Indigenous Australians. Stroke does not always lead in death, but it can lead to severe disabilities which can impact your life forever. 35% of people who have suffered a stroke have at least one impairment, and as a result this impairment can last for 6 months or longer. And 62% of these people will be permanently disabled, and we're more likely to report other long-term health conditions. As you can see from the bar graph, the most common impairment is physical activity, which is this one. And Amy will now speak about government policies and strategies.
Australian Government actions aim to prevent stroke through early detection and manage the illness through ensuring treatment is accessible and affordable for regional and remote communities. The government's policies on modifiable risk factors associated with stroke include smoke-free policies and legislations. These strategies include smoke-free areas and the increased tax on tobacco, aiming to reduce where people can smoke and the affordability. The strategies in place for prevention and early detection of stroke have been delivered through mass media campaigns, educating the public on the harm associated with risk factors such as high-fat diet, which has been highlighted through the Live Lighter toxic fat advertisement, alcohol consumption, through the What You Can't See campaign, and the graphic images on cigarette packaging also highlights the harm associated with smoking. The strategies around managing the illness include making treatment more accessible and affordable. The pharmaceutical benefit scheme includes some medication that are used to manage the illness, such as clopidogrel, which aids in preventing recurring clots. Another strategy in place is increasing the number of health professionals in regional and remote communities to enable greater access to health services for screening, such as health checks for early detection and education on FAST, detecting early signs and symptoms. So, I'm sure some of you would have recognised these before. So we've got Alcohol, Think Again. And this basically is talking about the education behind what excessive alcohol consumption does to the body and the effects it has. So I'm sure you would have seen some of these. So again, there's the cigarette packaging as well. So that's just highlighting the effects of smoking. To reduce stroke, we need to consider lifestyle factors such as diet, alcohol consumption, physical exercise, and smoking, and to avoid possible lifelong symptoms with a chronic condition. The message is that strokes are a medical emergency and they need to be detected and treated immediately. Now Angela will discuss the influence of the multidisciplinary team in managing stroke.
Thanks, Amy. Strokes, CVAs, as aforementioned, are not heart attacks but are actually brain attacks. It's a warning sign and needs to be addressed urgently. From that point on in the patient's life, they will need acute and chronic care because survivors of stroke will need to modify their life for the rest of their life as part of the burden of disease. Now, as future nurses, all of you guys will inevitably become part of a multidisciplinary team. You will play a very valuable role in your patient's journey back to health. Multidisciplinary teams, they advocate. The onset of illness is when your patient is at their most vulnerable. Be their voice when they have none. This helps to build therapeutic relationships for later. Educate. With the information and education on the disease, your patient will develop an understanding and knowledge, and that is empowering. Rehabilitate. Patient-centered care is to achieve the best possible outcome. The patient is actively involved in making decisions towards their own health. I'd just like to point out some key differences between the acute model and the chronic model. The first being doctor versus team-centered, episodic care, which means one time only or at the time of, and ongoing care. There's a single setting, such as the hospital specialist centres or community setting. Also one-to-one contact versus one-to-one or group contact. These are some of the teams that you may be involved in your future career as nurses. So in the acute setting, let's start with 000. Then there's paramedics, which are there to transport and sustain life. In the ER, you'll meet up with doctors and nurses. Now, tests need to be done to find out and indicate what's going on in the patient's body. Phlebotomists are there to take the blood, and pathologists are there to analyse it. To determine the type of stroke, special tests will need to be run. These are CT or MRIs, angiograms or echocardiograms, just to name a few. Then to diagnose and to treat the disease, you might need to be seen by a neurologist or a cardiologist, maybe even a surgeon. And before you leave the hospital, you might be seen by a social worker or a welfare officer. Now over to Courtney to talk about the multidisciplinary team involved in chronic care, management and recovery of stroke. Thanks, guys.
Thank you, Angela. I will be discussing the aftercare involved with stroke, specifically focusing on the rural healthcare services available for stroke patients, requiring that ongoing care and specialty services. People living rural most likely are uneducated of these services, which is why Australia and nurses are working to improve consumer access to information, patient communication, and putting into place patient-empowered models of care and self-management. To overcome the barriers people living in rural areas face with care and treatment of their conditions. As nurses, we play a vital role in meeting community needs by offering strategies to promote healthy behaviours, education on sources available and how to utilise them, as well as coordinating the care of a patient with the multidisciplinary team. Rural patients now have access to services such as Silver Chain and telehealth to provide a more accessible and available service of care. Video conferencing is just one of the ways in which telehealth is improving access to healthcare for rural patients. It is an initiative to overcome the barriers of travel and distance and the cost and availability of transport. The role of the general practitioner in the prevention of further stroke is to follow up patients regularly, ensuring optimal control of the disease that caused the stroke, assess and manage any new symptoms, and to encourage adherence to their medications. Many stroke survivors do need rehabilitation. It aims to improve mobility, physical independence, and social relationships by providing physiotherapy service, communication aids through speech therapy, and modifying the environment through occupational therapy, all to bring out the highest possible level of independence. It helps the person keep their abilities and gain back the lost abilities. Lastly, we have mental health services. It has a key role in supporting the stroke survivor and family in managing depression. Research by the Department of Health showed that people living outside major cities were 1.1 times more likely as their city counterparts to have had a mental disorder at some stage in their life. There is evidence to suggest that the high prevalence in rural communities is due to loneliness, isolation, and fewer health services. This is why the framework's overreaching vision is to improve their health outcomes, introducing services such as Beyond Blue, referral to a psychologist, and the Mental Health Emergency Care Rural Access Plan. If you would like further information, please refer to our fact sheet and always remember to act fast. Thank you.